Dr. Jeremy Gierman here with Inertia Medical, and I'm going to answer a question today that I got recently, and I get routinely actually, which is what is physical medicine and rehabilitation? Which I'm a physical medicine and rehab doc, a physiatrist as we're also known. That's my board specialty. And funny story for you, my father-in-law was referred to a PM&R doc by his primary care physician, and he called my wife, his daughter, who's a physician assistant. He said, "What in the world is a PM&R doc?" And she said, "Dad, that's what your son-in-law is." So it's still, people don't know what it is. Patients and other providers even, because it's a smaller specialty, a newer specialty in medicine. So I'll give you a bit of a historical background, and I think that I have my facts right here, but there was a Dr. Frank Krusen back in the mid-30s, I believe, who established a physical medicine department at Mayo Clinic. And then later, the American Medical Association recognized physical medicine as a boarded specialty, which I believe was in the 40s, around the time of World War II, actually. That was actually a significant time for our specialty because we dealt a lot with the injured soldiers coming back to the States and needing physicians and other providers to care for them, which brings up the topic of the folks that we do in fact care for. So we're trained in neurologic and musculoskeletal care, so disorders that involve the brain, the spinal cord, joints, tendons, ligaments, nerves, etc. So one of the primary kind of the philosophical underpinnings of our specialty is that we optimize function. We optimize function and quality of life. So we tend to have a broad approach to care in that we work very closely with other specialties, orthopedists, neurologists, physical therapists, occupational therapists, etc. So we often have a team, a holistic, a broad approach in order to, again, optimize function and quality of life. And as I mentioned, we are trained in the care of many different disorders. So because of that, physiatrists themselves will oftentimes subspecialize. So you might have a physician or a physiatrist who specializes in spinal cord medicine or traumatic brain injury, or someone like myself who specializes more so in the care of the musculoskeletal system or orthopedic injuries. So it's a very broad field, and we take care of a lot of different types of patients, but oftentimes patients who, for example, the folks that I care for regularly, who have an orthopedic injury, a musculoskeletal injury, that's not a surgical issue, they're not sure exactly who to go to, but a PM&R doc is the perfect provider in that scenario. Likewise, for some neurologic conditions, physical medicine and rehab doctors will follow them throughout the course of their condition. And we're also, some docs will refer to our specialty as physiatrists, and as I understand it, in the early days, there was an emphasis on that third syllable to differentiate it from psychiatry. Still, some days I'll get patients that Google Dr. Jeremy Gierman, and they see physiatry, and they call and they think I'm psychiatry. So they walk in the door with the wrong diagnosis, and we have to direct them elsewhere. But physical medicine and rehabilitation, a very neat specialty for those medical students who might be watching this video. I encourage you, hey, if you have any questions, send them our way. We're more than happy to spread information about this neat specialty, and for patients also who have various conditions of the systems that I mentioned, the neurologic and musculoskeletal systems. Look at physiatrists around you that might be able to help you with your particular issues. So anyway, hope that was helpful. A little bit about physical medicine and rehabilitation.